So we're going to be testing an individual doing the rapid COVID testing. And just so that people understand, the rapid test is testing for antigens for COVID. If antigens are present, then the test would be positive. If they're not present, then we assume that the test is negative, but we still have to take precautions because an individual just might need to be retested. There could be different considerations that the person is still positive. So we talk to them about what the results mean. First thing you do when you test is you have to get into the proper PPE, that's personal protective equipment, and that consists of a gown, and then I have my mask on, and I'm wearing an N95. The next thing I'll do is put a shield on, and the final thing is gloves. Always make an assumption that the person that you're testing is positive, and so you want to assume that all of the things that you touch, including the test, is disposed of properly, and that you're doing hand hygiene in between testing individuals. All right. The equipment that we're using for testing is our kit and a swab and solution. So I'm going to get the kit prepared. I'm going to get my assistant to open that up for me. Thank you. And a swab. And I'm going to prepare the person that I am testing. So I'll be giving you instructions on tilting your head back. I will insert the swab correctly. What I'm going to do is I'm just going to have you tilt the head back. I'm going to hold this like a pencil, and I'm going to put the swab in about 2.5 centimeters. Using one swab for both nostrils, I'm going to insert the swab going towards the cheek and the eye. I'm going to take it out with the swab. Sam, I'm going to have to move this for a second. Thanks. I'm going to keep a hold of the swab. I'm going to take the solution, the reagent, and I'm going to insert 6 drops into the top hole. 4, 5, and 6. Take the swab, insert it, bottom hole, into the top, and rotate it several times, at least 3. Then you're going to remove the sticker, press the test together. We like to hold the swab down for a few seconds. What you're doing is you're getting the reagent to mix with the sample on the swab, and it will move up towards the blue line that you can see. So we just hold. Once you complete your test, you're just going to leave that there. We'd like to write the name of the patient down there and the time that we put the sample in. It takes 15 minutes to be able to read this card properly. What you're going to see, you can see right here, is you can see the reagent is moving up the strip. And we're just going to follow that reagent all the way up. As with most tests like this, you're going to be looking for indication of the blue line, the top blue line on this, the control line, is, if that's all you see, it's a negative test. If you see 2 lines, distinct lines on the strip, it's a positive test. So you can see the indication of a positive test result on this strip. There are 2 lines. You have both your control and the sample is testing positive. You can see them clearly. So we will provide documentation to our patients on the results of the test, positive or negative. We will include the patient name, the date the test was taken, date of birth, the type of test, and then also the results. On our documentation, we are providing our patients with information from the CDC about whether you quarantine or not, what to do if you've been exposed but don't have symptoms, what to do if you've tested positive. This allows the patient that information that's clearly spelled out so they know what they should do if they are positive or negative. And then on the back, we also provide information on emergency treatment if that is needed. Then we sign, we put our name and any other kind of indication we need to give the patient. What's happening is a lot of employers are asking for documentation of either positive or negative tests. And so we want to provide this for our patients so they can give that to their employers or places of school.